I'm going to show you how to use a nebulizer breathing treatment for anyone who has asthma, COPD, or cancer of the lung, or pulmonary fibrosis. And this is just a way for the medicine to get down deeper into the lungs. So this is the nebulizer compressor, and this is just plugged into an outlet. And make sure then you have the tubing connected to the compressor, and this helps push the air and the medicine that will go into the resident's lungs. So here's the tubing here, it's connected here. And I know we got quite a few parts, but I'm going to show you how it goes together. It can be a little intimidating, so I don't want you intimidated. So make sure we have our little medicine cup, and you put that in the tube here. We have this little doohickey here, and that fits in, and that helps disperse the medicine throughout the cup. Some of them have like a orange or a green cone, and it just sets in there. If the cup doesn't close, then you don't have it on right. Then I have the medicine here, and it's like a bronchial dilator, helps open up the lungs. So you just twist off the top and you pour it in. And then you put the cap on and make sure it's on tight so it's not leaking out. And then I have my little tea tool, whatever that is. And this, I look at it as a peace pipe. You know, you gotta have where you're breathing in, the mouthpiece, and that goes in one end. And if it doesn't go, if you do it in the wrong end, it doesn't go in, just try the other end, because they're male-female parts. So this is what goes in the mouth. This is the exhaust pipe, sort of like a muffler, okay? Just like a peace pipe. So you turn the compressor on. I don't have the electric on. And then you make sure that they put their teeth around this and make sure the lips are covering that. And you just ask them to breathe normal. You may want to, every once in a while, encourage them to take deep breaths, okay? The treatment lasts anywhere from 4 to 6 minutes. You must stay with the resident to ensure that they still have that good seal around their mouth. When I turn this on and I know it's working, little steam will come out. And then you know you have everything put together then. So stay with them, encourage deep breaths in between. If they breathe too fast, tell them to slow down their breathing. Then when they're done, and it'll sound different, you may want to just flip this a little bit to help disperse some more of the medicine in there. And then you'll see most of it's gone, and you just turn it off. And what you do then is you take it apart, you detach this, you detach every single piece here, and you wash it with snap spray, and I rinse well, and then put it on a paper towel or a washcloth and let it dry then. So that's the way that we like to do the nebulizer treatment. But what's helpful is that I like to have the resident, if they're able to raise their arms prior to the treatment. And this way it helps stretch the lungs and helps open up the bottom parts of their lungs. If they can go a little bit to the left, a little bit to the right, that's good. Now, if they have any rib problems, you don't want them to do that. You don't want them to be up against the back of the chair. You want them to lean forward so the medicine is going towards the back of the lungs too. If they're in bed and they're having a hard time, you could use a mask. Or you can have them put their arms across the overbed table and they can lean forward in bed then. We just don't want their back pressed up against that bed or pillows. If you have any pillows there, get them away from the lungs because we want these lungs to be expanding and full of this medicine. Thank you.